everyone, and welcome to the clinical scenario 2 of this clinical series. Today we will be discussing a particular patient presentation, the thought processes you should have when presented with this patient, and how you would manage them. So, let me introduce you to Jane. Jane is a 35-year-old female presented to the clinic with persistent fatigue, muscle weakness, and gastrointestinal symptoms, including loss of weight, loss of appetite, and nausea. She also reports muscle cramps and joint pain. She has noticed increased skin pigmentation, particularly in sun-exposed areas and recent scars. Additionally, she experienced postural dizziness and has had a few episodes of a low-grade fever, which is accompanied by a headache. So let's try and think for a common factor that links these symptoms together. Let's review and categorize the symptoms. So we are told that, just move this out of the way. We are told that Jane has experienced fatigue and muscle weakness. These symptoms suggest a systemic issue that could affect the overall energy levels and muscle function. She also has GI symptoms, which may point to a chronic condition affecting nutrient absorption or metabolism. The fact that she has increased skin pigmentation, this can be indicative of a specific type of hormone imbalance. Jane has also exhibited postural dizziness, and this could be suggestive of issues with the regulation of blood pressure or dehydration. The muscle cramps and joint pain may be related to electrolyte imbalances or just general systemic inflammation. And finally, the low-grade fever and headache could indicate an underlying infection or inflammation, but in the context of the other symptoms, this may be less likely. So because the common factor here is electrolyte imbalances, let's look at a body system that deals with such a thing. So let's talk about the adrenal glands. Now, the adrenal glands produce a hormone called ACTH, or adrenocorticotropic hormone. What this does is it travels through the bloodstream to the adrenal cortex, which in turn produces aldosterone and cortisol. So we spoke about cortisol, and a low level of cortisol can actually cause increased skin pigmentation, which is what we can see with Jane. We also spoke about aldosterone, and a reduced level of aldosterone can cause a decreased sodium reabsorption and blood volume, and this can lead to a significant drop, especially when standing, which we can see in Jane as she exhibits postural dizziness. The muscle weakness can be explained by a low cortisol, again, and electrolyte imbalances, especially low potassium, which contributes to muscle weakness and fatigue. So the most appropriate test for Jane would be investigating her cortisol levels and ACTH levels. And if the cortisol levels are low and the ACTH levels are high, this would be indicative of Addison's disease. So for Jane, the most appropriate test results would be those investigating her cortisol and ACTH levels. Further lab results would also show a low level of sodium and a high level of potassium, and that is consistent with what we spoke about when discussing the mechanism of the adrenal glands. And that is also consistent with the presenting symptoms. So now you can see how these kind of things link together and what the thought processes would be when presenting with something like this. The treatment for Jane would be to replace the deficient cortisol by giving glucocorticoid replacement or mineralocorticoid replacement. This will normalize the metabolism, the stress response, and blood pressure. And finally, you can also advise to eat a balanced diet. This ensures adequate nutrient intake and could help manage electrolyte balance, supporting overall health and just kind of mitigating the symptoms like fatigue and muscle weakness. Alright, that concludes the video. I hope you found it useful and stay tuned for more.